All right, welcome back to step 3 of strengthening for the shoulder girdle. We're going to be going over 3 strengthening exercises. 1 is to build the foundation of your middle trapezius muscles. 2 is to build the serratus anterior, which is an upward rotator of the scapular or shoulder blade. And then 3 is a thoracic extension. So it's not directly related to strength. However, in order to have full range of motion in the shoulder, you have to have a bit of mid-back extension. So I'm going to go over a foam rolling exercise for that to help improve that. Let's get started with the mid-trap. So we're going to go over the middle trapezius activation, which is a prone eye position. You're going to need a towel, like a hand towel roll, rolled up like a burrito, about 1 to 3 inches of thickness. You're going to place that on a table, a yoga mat floor, something that you can lay flat on, and then rest your forehead right on top of it. This is what I mean. Here we go. You're going to place the towel roll right on the table. Lay down on your stomach with your forehead resting on the towel. Slightly tuck your chin down. Hands on the table. For starters, putting your palms up is going to be the easiest. For advanced, you're going to want to put your palms on the table. Now what you do is pinch your shoulder blades together and then lift your hands up off the table an inch. The idea is just to get the middle shoulder blade pinching together where you can feel that muscle contraction and lift up. You don't want to bring your shoulders up towards your ears because you're going to start having a lot of activation of the upper trapezius muscle, which could be causing some of your shoulder dysfunction. Keep those shoulder blades in a neutral position. You don't have to slam them down like a big cue, what people say. Just bring them back in a neutral position, not too high, not too low, right in the center, and then lift your hands up. The goal of that is going to be for 1 full minute. However, that's going to be pretty difficult right off the bat. You might need to start at 15 seconds, 20 seconds, 30, build up to a full minute, and then eventually 3 sets of that. Once you've done that, you've created a good foundation to build on top of. That means you have good activation of one of your scapula stabilizing muscles, which in turn can allow your other shoulder muscles to perform as they should. So that was the prone eye exercise for the middle trapezius. Now for number 2 is the serratus anterior muscle. It's also called your boxer muscle. So if you were to punch, you're going to really just extend and push that shoulder blade forward. It's found on the front side of your shoulder blade, and then it wraps around the ribs, and it's responsible for upwardly rotating your shoulder blade, which in turn would increase the joint space here, so you don't get that pinching syndrome. And it also helps reduce that risk of having a rotator cuff tear of the most common muscle, supraspinatus. Here's how you can start activating that muscle and working into that upward rotation motion. So you're gonna go onto your hands and knees, but what you're gonna do is place your thumbs going straight ahead, just like this. So I'll give you a different view. So your thumbs are gonna be facing upward, straight ahead. Not your fingers, just your thumbs. Then what you do, hips shoulder width apart, is you're gonna push your chest away from the floor or table, and then keeping that push, you're gonna glide your hips down towards your heels, keeping that push. And then you're going to come back up, keeping that chest away from the table. And then what you do is keep your elbows straight, lower down, push out again. Activate that serratus anterior, keep that hold, keep that push, keep that chest off the table there, towards the ceiling, and push towards your heels. What this is doing is causing your serratus anterior to activate and then use it to upwardly rotate your shoulders. So with that shoulder blade upward rotation, creates joint space, reduces shearing and compression stress on the shoulders, therefore allowing you to reach up overhead with less discomfort. As far as reps, sets, duration, and all of that, you've got to listen to your body, but a standard, if you will, is 3 sets of 12, build up to 3 sets of 20, because this is not a bodybuilding, bulking muscle. You want it to have endurance. So higher repetitions is ideal for this one. Build up your tolerance. 1 set of 10, 2 sets of 10. Eventually build up 3 sets, 5 sets of 20. It's an endurance training in order for your serratus anterior to work properly throughout the day. So when you're reaching into the cupboards to grab a bottle or a glass or a plate, or you're lifting something up, whatever it may be, you're covered. Serratus anterior is keeping you safe. Now let's move on to number 3, which is the thoracic extension with a foam roll. Let me grab the foam roll and I'll show you that one next. So when it comes to a foam roll, density does not play a role in improving flexibility or mobility. However, what does play a role is consistency in training the mobility. So I'm going to show you how to use a foam roll. This one's a firm density just because it doesn't denude or it doesn't lose its shape and all that, and this is what I prefer, but by all means you can use the softer one or anything that's to your tolerance. Here's how you use the foam roll for the thoracic extension, allowing you to have more freedom of movement. You're going to set your foam roller right behind you, hips and knees bent. So you're going to place the roller behind you, go and lay back on it. You want it in the mid back, because you're going to target the low, middle, and higher portion of your middle back, your thoracic spine. So what you do is you're going to tighten up the abs a little bit. You don't have to hunker down, but tighten them up. Hands behind your head, and you're going to arch over the foam roller, controlling your breath and breathing as you bend over it. Hold for a few seconds and return. You're going to repeat this 3 times. All right, now you're going to roll down to another portion of that mid back, and you're going to repeat 3 arches over. Keep the abs engaged, arch over, and back. Very good. And last one, roll all the way down to the upper portion and repeat. 3 reps. After that, go and lift the hips up and give yourself a little ironing on the paraspinal muscles and the spine there. So that's how I would use a foam roll to improve that thoracic spine extension motion, which in turn will allow you to reach up overhead and get that end range of motion. All right, so that concludes the thoracic spine extension mobility. You know what? I have a bonus for you to tie all of it in together. So now that we've gone over the pronai for the middle trapezius, the push-up plus prayer, and then also the thoracic spine extension with the foam roll, because that was more of a mobility exercise, but crucial when it comes to shoulder health, I have one more strengthening exercise coming your way. I just need to grab a band. I'll be right back. All right, got a band here. So here's how you perform the protraction with elevation exercise. Target tissue is going to be the serratus anterior, upward rotation, and more of a movement or more of a functional pattern where you're reaching up over your head. Go and throw that behind your back, wrap it around your back, and put it high just under your shoulder blades, like this. You're going to grab the handles just like this. All right. Then what you do is you're going to push out towards the front like you're trying to touch the wall in front of you, and keep that push as you're reaching up over your head. So right here, I'm pushing towards the ceiling and then around. So the entire time, I'm putting resistance on the band by pushing away from my body. What this does is allows your shoulder blades or that serratus anterior muscle to engage and upwardly rotate as you're reaching up over your head. So here's another view for you. You're going to push, reach on up, and back down. It's a great way to tie in those 3 exercises that I have just gone over, linking it all together. All right, so that concludes our step 3 of strengthening. Stay tuned, and I'll see you guys in the next one.